I'm joined by the head of the Caribbean School of Nursing at UTech, Dr. Adela Campbell, who wrote and published the Jamaican public health system from the 17th to the 21st centuries. So we asked her to come in and give us an overview on how the system is impacting Jamaica's health. Good morning.
Good morning.
Smile Jamaica, it's morning
Thanks
time.
for having me.
I like the idea, Doc, that you start with a historical narrative, first of all, and perspective. Because how important is that for us to understand the genesis of the system and where we are today?
Okay, so if we really don't understand our history, we really can't fix or know where we're going.
Right.
And so it was important to look at the reform system over the period of time that I have looked at, because if you notice, over the years, they have been having several reforms, but the issues still remain.
Yes.
And so in evaluating the most recent reform, I thought it prudent to look at what happened in the previous centuries.
How is our colonial history shaped the way the system is set up in terms of what hospitals are, who accesses what type of care?
Right. So well, during the colonial period, as you know, healthcare was mainly for the whites.
Correct.
And after the abolition of slavery, then they thought it prudent to provide healthcare for those who were enslaved and are now free. And so they had to build institutions that would cater to the needs of those people, because they really had no proper primary healthcare facility, you had no proper secondary care facility. And so out of that, you had like the Kingston Public Hospital being built, and then the Victoria Jubilee Hospital coming on board in order to administer the kind of services that were required at the time.
So you do a great overview, and you also set up the way in which the system is structured.
Yes.
So we're a sharing of public and private. And then you've spoken about the types
of
hospital.
Type of facilities.
How important is it for us, even as users, to understand that this is what this type is and is the service that is offered at this type of hospital?
Right, very important, because if you notice, in some facilities you have overcrowding.
Yes.
Because persons are moving from one institution to the next because they really don't understand what services are offered at what facilities. For example, for level one, type 1 health centers, you have basic services like maternity services, and mothers would be better able to access maternal services in those facilities, right? If you're thinking about accessing advanced services, like if you want to do an MRI and a CT scan, then you would want to go to an advanced facility like a type A hospital to get that type of services. And one of the things we find is that persons tend to go to the more advanced facilities like the type 5 health centers and the type A hospitals, because you have all the services under one umbrella.
So you find that those tend to be crowded.
Right, because persons want everything to be in the same place. So if I go to the doctor and the doctor orders a medication for me, I want to know that there's a pharmacist there where I can access the drug. Or if I'm expected to do an X-ray, then the X-ray department is there. I can go do my X-ray, and at the end of the day, I have all the services I required, and I'm on my way home.
Is it also a level of trust? Because in our mind, when we hear type A, B, C, or level 1, 2, 3, 4, I say, I got the highest level, you know, because I feel the better doctor them is at that level, and more things are at that level. But really, the level really just says what type of service is offered. Right.
So it's type of services
and
that
not a reflection of the quality.
And sometimes it's a reflection of the quality, because in the more advanced facilities, you have more. Say, for example, you would want a cardiologist. You're not going to find a cardiologist at a type C hospital. Okay. But you would find one at a type A hospital. So you will find that they have the confidence that the specialist that they need would be at a type A facility. So they tend to gravitate to those institutions.
Given what's been happening, I mean, as time has progressed, we see more NCDs are an issue globally, non-communicable diseases, and other things. I know some adjustments have been made to upgrade some of the facilities to make sure more and more services are offered. But from your data in it, do you think that we still need to have more type A's? Right, I mean, we have Bustamante for children.
For children, yes.
That's it, and we have Holy for children.
Oh, good, and so...
What are some of the things that we need to address?
Right, so yes, you're quite correct. We really need more institutions to cater to the need of Jamaican, because you find that you have population explosion over time, and we have the same facilities. I know they have plans currently to build another children's hospital in the western region, and I think they're quite advanced with those plans. But you're right. We need more facilities that would cater to the needs and make healthcare more accessible to those everyone who need it.
Another thing that was affecting access was the cost.
Yes.
And you raised this in it, that people are not able to, not everyone, because not everyone has health insurance.
Certainly.
And not everyone has been able to access the kind of care that they require. I mean, how do we address that? I know one of the things they were saying, free access to some services. Some services. Right. How has that helped to make access, better for Jamaicans? Okay, so it was found prior to 2008 that persons who really required the health services were not accessing it, and they thought it's because of the charges that were there for services. Right. But subsequent to the abolition of user fees, you found that persons were still not accessing the health services. Right. So yes, there was an increase in utilization in 2008 after the abolition, but then it went back to what it was before. Which means people were still not accessing the healthcare, which suggests that there are other barriers to persons accessing the health services. It could be that they don't have any confidence in the health system. It could be that in terms of where the locations of the facilities are, it's a barrier to them accessing in comparison to where they live, and so on. And even with the private care, if you go look for your doctor, you sit down all day. Right, and so, but one of the things though I found is that persons were not averse to visiting the institutions from 2 a.m. in the mornings and waiting for long periods of time to be seen. Really? However, they thought that was okay with them, which in itself is a barrier to accessing health services, but they did not see that as a barrier. Because at the end of the day, they were going to get the services that they actually went for, and they would be going home with some medication and so on. Right. When in fact, that is actually a barrier, having to wait long periods of time to access the service. What about staffing? Staffing, you have an organizational structure that speaks to, from the Ministry of Health to the regional health authorities and so on. Yes. But how is that organizational structure effective or ineffective? There's a perennial problem in the health system, in the public health system. Right. And there is one issue with what we call the cadre, which is the establishment of professionals that are engaged. So we talk about the doctors and nurses, the pharmacists in the health system. And over the years, what we find is that the number of persons are employed, because we have more persons being trained and they're employed in, but they're really not in any post. So they're really not getting all the benefits that they should actually be receiving. And of course, with migration, you have large numbers, say for example, nurses migrating. So at all times we have a shortage of staff, in the qualified staff in the facilities. So until these issues are addressed, we will still have, and especially in the rural areas. And one of the things, or the suggestions that have been made over the years, is that, for example, in the rural areas, the nurse practitioners, because we have large number of nurse practitioners not large numbers, but sufficient number of nurse practitioners in the system who work just like the doctors. In fact, the patients prefer to be seen by the nurse practitioners in these facilities. They could be given prescriptive rights to work in like the deep rural areas where persons are unable to access the quality service that they need. Before we go, I mean, there's never enough, I believe, allocated in the budget for health. But we've been seeing, as you say, the migration of our nurses. Initially, it was of their own volition, now Jamaican nurses are being courted to come overseas.
Certainly.
So we have the expertise.
Yes.
Why are we not holding on to them?
Is
the disparity in their pay?
That's a very interesting question.
Yes.
And the answer there are various perspectives to that answer. But initially it was thought that it's because of the pay, salary, because of course even the region, Jamaican nurses are the lowest paid in the region. And but when we did this study, however, we found that is just one factor.
Okay.
So yes, they are disenchanted with the salary,
but
working conditions, because if you are assigned to a unit and you really don't have the materials and supplies to work with, you want to give an injection and you don't have a syringe. And the patients sometimes get very boisterous and abusive.
Yes.
And you're there thinking, I need to give the injection, I don't have a syringe. You're going to get frustrated.
And the area in which you work.
Exactly. And sometimes they have to rove units to get things to use on a particular unit. So I'm on Ward 1 and I want say a female catheter and I can't find it. I have to go to Ward 2 to see if they have a female catheter to be able to attend to my patient. So that is very frustrating for the health practitioners. And so these are some of the reasons why. And again, the kind of support, administrative support, is sometimes not there. So for example, you have nurses who have children. And some institutions really don't have like a daycare center, and there's no facilities to accommodate these type of arrangements. And so they get frustrated after a while. Persons want better quality of life. And so you'll find them moving. And as you rightly said, the recruiters really...
They do.
Yeah, they really, yes, they go after Jamaica because we have a reputation across the globe.
Yes, yes.
You know, we have a reputation.
All right, thank you so much. This book is available. We have to go. It's available where?
Yes, so the book is available at the Kingston Bookshop and Brian's Bookstore, and it's $25 US or 3,375 Jamaican dollars.
Well, let me tell you something.
Or the equivalent to the 25 US.
Yeah, it's an easy read, so you don't have to have the medical knowledge to understand it.
True.
If you're a medical student, a nurse, if you're in the health sector at all, it's a must-have. But as a regular Jamaican, it gives you a better idea of how the system is and a better way of accessing what is available to you. So thank you so much.
And just to say that it was published by the University of Technology Press.
And
it is the first book to be published by the UTech Press.
Go on, Dr. Campbell. You're a blazer trail.
All right,
the head of the Caribbean School of Nursing at UTech, Dr. Adela Campbell. That's it for 10 Minutes to Your Health. We'll do it again next week.